Happy Sunday, everybody! Welcome to episode 2 of Dr. Gregory's Meta Moments. Thanks for joining me today. I wanted to talk more about the book Boundless today. Last week I told you I will be reviewing 3 separate books over the course of weeks: Boundless, Metaphysical Anatomy, and The Biology of Belief. And the reason I'm going into these books is because I feel that they approach the human body in a very unique way. It's not just about the physical. It's not just about the chemical pathways that we learned in medical school where A goes to B, goes to C, goes to D. It talks about not only the impact of quantum physics, but the impact of your emotion on your physical state. And I talk a little bit more in depth about how to biohack your body a little bit here. So today we're going to be talking about hormones, specifically estrogen and testosterone. And because of that, I'm going to review the book Boundless. I think that gave me a great summary of hormones and how they impact your body, but how also correcting those hormone levels can help you feel better inside and out. So let's get into it. I'm going to start with a quote, and I also would like to do that every week. Start with a quote, since that pretty much mirrors how I did my Sundays with photographs. Okay, so your perspective is always limited by how much you know. Expand your knowledge and you will transform your mind. That's by Dr. Bruce Lipton. So, into estrogen. Let's talk about estrogen from the book Boundless. And for anybody that's actually following along in the book, I'm looking at page 392 and 393 of Boundless. So, estrogen is a steroid hormone that is found in both men and women. So, some of the functions include, it stimulates a chemical called choline acetyltransferase, which is something that helps prevent Alzheimer's. It also increases your metabolic rate. It improves insulin sensitivity. It regulates your body temperature. It helps prevent muscle damage. It maintains the muscle. It improves sleep, maintains collagen, enhances magnesium uptake, and there's so many more effects, but those are some of the major ones for estrogen. Normal levels tend to vary for men and for women. Men tend to have relatively continuous estrogen levels, and they only have a noticeable change during aging. Women, however, have a substantial fluctuation in estrogen levels based on their cycle, if they are still cycling. So during the phase changes, estrogen is the highest right before ovulation and the lowest during follicular development. Follicular development means egg development in your ovaries. It also significantly decreases as women age. So in menopause, the ovaries store more eggs and release them in the fallopian tubes, but menopause happens when the ovaries are no longer able to produce high estrogen levels to allow for this to happen. Low estrogen levels can cause symptoms like weak bones, which is osteoporosis, age-related bone fractures, mood swings, hot flashes, headaches, depression, trouble concentrating, and fatigue. Testing and treatment, well, there's a few options for testing and treatment. I personally prefer blood draws, although I know there are a lot of doctors who offer salivary testing and do it over the cycle so that they can see a trend going on. I think that's a very highly specific way of doing so. So there's definitely more than one method of following your estrogen. The best way to achieve optimal estrogen levels, if you don't have them already, is bioidentical hormone replacement therapy. So let's get into testosterone. Believe it or not, 25% of men over 30 suffer from low testosterone. Can you believe that? That's quite a bit. Nearly 39% of men ages 45 years and older have a low testosterone. That's also pretty profound. It's known as hypogonadism. So, normal testosterone levels, I can give you some ranges, but of course this is based on laboratory values, and it doesn't just involve your total testosterone levels. Your free testosterone, which is the bioactive testosterone in your body, is what has more of an impact on your body than it does your total testosterone. So it can range from 250 to 830 in a 19 to 49-year-old. An age older than 50, anywhere from 193 to 740. In females, testosterone is usually around 8 to 48. And then free testosterone, your levels can be anywhere from 32 to 168 in a male, and in females, 1 to 5. So symptoms of low testosterone can be quite impactful. On women, it causes, causes of low testosterone are menopause, childbirth, chemotherapy, adrenal stress, endometriosis, depression, psychiatric trauma, birth control pills, and certain medications. In men with low testosterone, they may feel symptoms of low libido, which is also felt in women, reduced erectile dysfunction, loss of lean muscle mass, fatigue, obesity, depression, and believe it or not, increased risk of death. I want to get into that a little bit. So, testosterone that is low in men is also called andropause. It is associated with higher incidence of diabetes, dementia and Alzheimer's, heart attacks, frailty or sarcopenia, which just means low lean muscle mass, osteoporosis, and low testosterone is associated with inflammation, which is a huge part of your ability to recover and your ability to feel vital, and your oxidative stress, which is what is like rust on your body. I want to talk about that actually. Oxidative stress is like a rusting on a piece of metal. The more oxidative stress you have, the more damage there is to your cells. And believe it or not, there are many types of antioxidants out there. And your diet isn't the only way you can improve your antioxidant levels. Testosterone has antioxidant effects. And believe it or not, although there have been some concerns in studies in the past that testosterone therapy can A, increase the size of your prostate gland, or B, potentially have increased risk of prostate cancer, these have found in research studies to not be true. They have been found to be false. The other potential risk that we are still required to speak to patients about is the association of testosterone therapy with cardiovascular ailments. But in many studies since then, it has been found that testosterone therapy, when it's bioidentical, has been seen or found to decrease your incidence of cardiovascular events. So that's actually quite exciting. Lastly, let's talk a little bit about testosterone and vitamin D. Vitamin D is a big subject lately because your vitamin D levels also help with your immune system. And so, believe it or not, I recently got a viral infection, like a cold, and I had this strong feeling that my vitamin D level was low. Vitamin D has a profound impact on your ability to fight infection. And it turns out my vitamin D was absolutely low. It was down to 22, and your normal range is 30 to 100. We tend to try to want to bring it up to more around 40 or 50 for your average patient. And it's actually quite surprising how many people are low in their testosterone levels unbeknownst to them. There are dietary ways to increase your testosterone. There are also ways by exposing yourself to the sunlight. But in most cases, this is not sufficient. In most cases, vitamin D supplementation is recommended. And it's also very much recommended for patients who are actively undergoing testosterone therapy. So increasing your vitamin D stores can improve or boost your testosterone level and other related health measures such as sperm quality. One study found a link between vitamin D deficiency and low testosterone. When participants spent more time in the sun, the levels slowly started to increase. Testicles have receptors for vitamin D, and they suffer from less than normal levels of testosterone. The receptors which suggest that the vitamin plays a role here. A previous cross-sectional study found a link between vitamin D levels in the blood as well as testosterone levels in the blood. So it's quite important that if you're working on normalizing your testosterone levels, that you also improve with your vitamin D levels. That's today's hormone replacement / hormone information, bioidentical hormone replacement therapy, testosterone and estrogen. It has profound effects on your body. It improves your vitality. And believe it or not, low testosterone in patients over 40, the mortality rate of those patients has been found to be 40% higher. That's a huge deal. So pay attention. You may not be feeling right. You may not be able to put your finger on it. Maybe you have some poor sleep. Maybe your libido's off. Maybe you have a lot of skinny fat going on. Maybe your muscle mass is low and you're wondering why. Maybe your recovery level ability is low. Maybe you don't heal from injuries very quickly and you may be wondering why. It's very important for you to consider that possibility. Thanks for watching, everybody. This was episode 2 of Meta Moments with Dr. Gregory. Love you all.